We have some new instructions from our staff about running our meetings in this conference room. This feels a little loud to me. Hopefully it's not too loud for those of you in the audience. I like seeing your bright, shiny, masked faces, fabric covering faces. Welcome. It's now Tuesday, April 22nd. We have some new tags on our microphone with a reminder of the distance between ourselves and the microphone in order for the mic to pick us up. The other problem that the tag doesn't refer to is that when we look off to the side to look to one another, the mic doesn't pick us up off to the side. So we're going to have to be very careful about moving the microphone with us so that the audio for our work sessions can be picked up properly. So without further ado, we'll go to the first item on our work session agenda. Right now we have Chair Harrington, Commissioner Rogers, and Commissioner Treese here in the room. So we have board and leadership communication. Who would like to go first? Commissioner Rogers.
Good morning. I guess I should mask up, but I think that I'm far enough away. Had a JPAC meeting last Thursday morning. Always interesting to see how we communicate with one another when we're on, a Zoom atmosphere with a whole lot of different faces. So it worked well. They were a little curious about some updates we had here in Washington County, but I think that went well. Beyond that, not a lot going on in this environment.
Commissioner Treese.
Good morning. We had our last meeting of the Get Moving Task Force. Woohoo! That was, and it was really a good meeting. It gave everybody an opportunity to go on record. The meeting was recorded Zoom meeting, and we had a guest appearance from Congressman Earl Blumenauer and a guest appearance from President Peterson, thanking us for the work that had been done over the course of the year and a half, 22 meetings, and also thanking us for setting a new standard for developing this type of package, that it really hadn't been done this way before, and watching the process was, it provided an education to everybody about how to do things differently. At the end, everybody had their beverage of choice and toasted on Zoom. We intend to have a get-together when we can, hopefully when the measure is referred. So at that, we were concluded, and I just gained quite a few hours a month. So pleased about that.
Well, thank you for being our representative, but also thank you for serving as co-chair.
Thank you. And we will, I'll continue to be in the loop with Metro staff about what's happening with this, and I'll be reporting back. So we haven't lost the connection there. The task force is just not meeting as we go forward.
Yeah, I appreciated the summary as well from the 32 plus members of the task force, that they found it was a really a great process, starting with values, making sure that equity was strongly in the mix, but also the representation from different sectors of our community. So job well done.
Thank you. I think the loudest thing that we heard was everybody felt they had a voice, and there's nothing more important in a public process than having a voice.
Great. Commissioner Dick Scouten and Commissioner Jerry Willey have joined us. We're doing board communication right now. Which of you would like to go first?
Just a couple of things. Looking back, last week I did attend a Zoom conference with the Regional Disaster Preparedness Organization Policy Group. Just for your information, I expressed my personal views that I thought that the governor's time schedule and what she was doing in her recent announcements and what we're doing in terms of the overall, overarching program of staying home, et cetera, was on target. That we were fortunate that we had started as early as we did. There's a big difference between how we performed on the West Coast and other places, and there's going to be unfortunate negative consequences. I think that's probably the view of the rest of the board as well, but you can let me know if you have concerns about what the governor's doing. We are having these Zoom sessions every week. The next one I think is Thursday. Then tonight I have a Five Oaks, formerly known as the Washington County Museum Board meeting. I think they're doing reasonably well. I think I continue to be impressed by our relatively new staff. Our two co-directors have been co-directors for the last year and a few months, and I think doing a great job. And I'll have a further report for you about the museum next week. Thank you.
Commissioner Willie?
Good morning, Chair. Yeah, it was, you look back on the weekend, you say, okay, the meetings that we have on our calendar, some of them happened and some of them didn't. Some of them was Zoom, certainly none of them were in person. But of note, it was yesterday we heard John Pogna, is that how you pronounce his last name? On kind of a variety of things for an update. I will hear that again tomorrow morning at my GPI board meeting, which of course will be on Zoom. And then Pam and I have been working a lot with Alex and the team on certainly on our grant and loan package and rolling that out. Alex is prepared to make any responses, I guess, make a presentation if the commission wants to hear more of an update. He's prepared to do that either later today or right now, whichever one you prefer. But yeah, it's just staying busy. Again, working with the Hillsborough Community Foundation, and we had about $220,000 to give out to a variety of organizations here and around Hillsborough. And I believe we're going to have another group of funding probably in about another week. So the community and our private sector have really stepped up and made contributions with that designation that has to go to families, has to be for food and rent, and certainly we're using our community-based organizations to help us with that. So other than that, I don't think I have anything else. Did you want to hear from Alex now? Or you want an update on that? Because remember we ran it out last week?
I think it should come under the COVID-19 update section of the agenda.
Perfect.
We have several
Perfect.
different
Okay.
things that should be part of that update.
Okay.
Okay, for my communications, last week we had the Washington County Visitors Association Board of Directors meeting. Hotel occupancy is at about a 20% average across the industry right now, which is down greater than 70% compared to last year. So no surprises really compared to where we've been at since the very early of March. We started to see some slowing in February as the word of what we now know as COVID-19 has made itself known in our community. They're projecting that the transit lodging tax will be down about 85% in April, May, and June. And forecasting that in fiscal year 2021, there will likely only be about $2 million of TLT revenue to the association. The Washington County contract is up with WCVA in June of next year. Tourism grants were reviewed and provided for both capital and small projects, and the board voted to advance the July payment to the 9 county chambers. That is merely an advancement of the July payment. As most of us know, chambers are 501c6s and have not been part of the federal COVID assistance programs. In the course of our COVID update, We'll have 2 memos to go over as well, one on congressional funding and one on gas tax acceleration. I want to highlight that I sent you all this morning a copy of the governor's reopening proposal slides. And then also another wonderful result since last week, the Work Systems, Inc. layoff aversion program had a second round of funding. And as you may recall, this is a series of funding to help keep our regional CBOs, community-based organizations, operating. And we work in strong partnership with them. So it's really vital that we keep them healthy and running, because now more than ever we are relying upon them. So I think that's it for board communications at this point. We've got leadership communications next. So CAO Rhodes.
I have just a couple of items. One, I'd like to announce the selection of Kevin Moss as clerk of the board. I know you got an early notice on that yesterday from the chair of Clackamas County. Kevin comes to us from Clackamas County, and he has been there for 5 years and served as their assistant clerk of the board. The last year has actually fulfilled that function. He'll be joining us in May.
Related to that, could you circulate the job description or job posting for the clerk of the board to us all as well, so we have a good grounding on what that involves?
And we'll circulate more information on Kevin as well.
Terrific, great. Are you hoping he'll start in early May, end of May, middle of May?
May 4th.
Oh, early in May. That's
Early May.
terrific.
Yes.
Great,
Yes.
great. May is just around the bend.
Yes, and now we'll hear from our colleagues in Clackamas County about stealing him away from them, so.
Yes.
They've stolen a lot from us.
Well, but the good news is, it's great to have public servants staying here in our region and definitely in our state, so.
Yeah.
Yeah.
And the other thing I'd like to share, and Diane may also, but in conjunction with Clean Water Services, we have retained the services of Echo Northwest to take their regional information that they prepared and bring it down to Washington County level for us. And it's actually in 5 phases that they'll do that work. And we expect to have the main piece done as we start budget. So we'll be able to, we are planning to begin our budget process going through their look at what's coming for us, what it looks like. So, and very happy that Clean Water Services helped put that all together. Actually, they're the ones that brought it to the table and we participated.
Thank you. Can we do Alan? Washington County, Alan Rapplier?
Thank you. My office has been working with the CAO's office on this ever-changing dynamics. Paul has been doing a great job of working with the HR policies, and Brad has been here every day, I think, working with the health department. So we've been trying to stay on top of that. The litigation keeps coming, and the cases keep rolling, so as you know. And just for your information, yesterday the U.S. Supreme Court struck down our unanimous jury verdict. We had a non-unanimous jury verdict requirement in Oregon, so that's going to be some changes. That's going to happen to our district attorney's office. That's it.
Clean Water Services.
Yes, well, I'd like to add on the Eco Northwest work. So it's going to provide us with a common data set to look at that's unique to Washington County. Each county has different attributes that makes going through the shutdown, the startup, and the recovery nuanced. So we're hoping to get a good data set to help guide Clean Water Services also in its role in the economic recovery as it relates to families who are having difficulty probably paying their underlying sewer and stormwater rates, to businesses and to the housing. So we'll be looking at that. So Clean Water Services has developed sort of a structured way of looking at investments. So while we have what we wanted to do in 2021, we prepared that budget. We've done it in a way that allows us to make quarterly decisions of whether or not to deploy. So we'll be teams really rallied around this.
Is your mic on?
Yeah.
Okay.
Maybe I need to get, it says not to be so
I
close.
think so, from the signals I'm seeing.
Okay. So the teams really rallied around this concept. So we've been looking at what happened to the industries back in the last recession to see what the recovery looked like. And it was interesting. The recovery differed between different sectors within the region even. So we learned a lot, so we have some good data sets, and we're looking forward to that. Dr. Williamson and I are participating as part of a global collaborative to look at utilizing the wastewater system as a way to help monitor community health. And it's interesting, it's folks from Europe, it's the CDC, EPA, folks from Australia, folks from all across the US. We didn't have anyone from Asia there, but there's research across the globe looking at detecting sort of the fingerprints, so it's the proteins of the COVID virus within the wastewater. We did get some results back from one of the research groups that we're working with called BioBot, and it is interesting. So we don't yet have a trend. We have 2 points, but the 2 points are showing that it's growing, which is not to be unexpected. And their estimates of numbers are greater than the estimates that are currently tested at the hospital, which is not to be unexpected. So it has some interesting information that we'll be sharing with public health and with the board when we have more validated data sets to share. But it's interesting. Those meetings happen at 5 a.m. because of the time zones around the globe. So it was really fascinating. Folks in public health across the globe and in the water industry, we share a lot of common goals. So we'll look forward to sharing that with the board.
Some of the work that you're doing made it to the local news recently, I saw.
Yeah, it sure did.
I think there's one other Clean Water Services update. We now have these buttons that staff throughout Clean Water Services, particularly those who are deployed in the field, have some visual aids to help remind members of our community that physical distancing is something that we all need to maintain, and while they're working to keep our stormwater and surface water systems working, we need to make sure that we are keeping our distance for them so that they can continue to concentrate on what it is they're needing to do in service to all of us. So thank you very much. We'll keep role modeling the physical distancing and protecting others. Thank you. Are there any questions on today's formal agenda for our 10 o'clock meeting? I know I have one.
Yes, on item B, Madam Chairman, I'd like to remove that so I can vote on that separately on the consent agenda. That's a TDT.
Okay.
I'm sorry, Roy, which one's that?
Under Land Use and Transportation, to authorize the Transportation Development Tax Annual Index Adjustment, Commissioner Rogers would like that to move to the action items section. I have 2 questions. The agenda has changed to include the minutes for April 7th. Those were not marked as an addition compared to when the agenda was first published. Also, there is an update to item 7A, to declare an emergency related to COVID-19. It was revised, but there was no information as to what was revised, so that's my question.
I'm trying to recall what exactly revision we did on this. Oh, I remembered. It was the community feedback. I added issues on the community feedback, that there were 7 comments that the board received through email that were mainly interested in getting the community back open. But as
So-
I pointed out, that's not our order that closed down the community. It is the governor's order, so.
So that would mean on the topic sheet, under additional information, community feedback was updated, but the actual resolution and order itself is, continues to be the same as what we,
That is correct, yes.
the same model.
The
just-
resolution did not change at all. I just added a little bit so you understood that there was some community feedback that people were interested in getting the economy going again.
Thank you very much, Alan. Appreciate that clarity. Are there any other? Yes, Commissioner Treese.
I just want to note that under item 2C, WSP is a member in good standing of Westside Economic Alliance, along with all the other members. Just for notice.
Okay, great.
I would like to make a comment on 7A as well. I'm certainly in support of the action, but Alan, I think it's a question to you. We're a subdivision in the state of Oregon, and I've been asked over and over again, could Washington County do something different? And I don't see that, even if we wanted to, we couldn't. Is that something that we should express during a hearing so people understand that we can't make rules up on our own here at the county versus?
Right, Commissioner Rogers, members of the board. Yes, we are, under the supremacy clause, we are a subdivision of the state of Oregon. They control us. And so we can't do anything less than they did. I mean, we could go a little bit, do additional things, but we can't if they set the floor. And so we can't do anything less than what they order.
I would suggest during, you might want to reiterate that. I think
Would you like me to mention that in the staff
They're
report?
very confused. They think that we can do something, even if we wanted to, different, and it's not true.
I can certainly raise that in the staff report.
Thank you.
Great. Any other questions on the formal agenda at 10? Nope, seeing none, we'll move on to the next item on our agenda, which is a COVID-19 update. I know we have several different topics that we've had in this realm. Good morning, Marnie Kyle, our Director of Health and Human Services, who has really stepped up to the plate, taught all of us a lot about public health, emergency operations, and has served as a tremendous champion to make sure that good, verifiable information is available all throughout our community. So thank you for all of your efforts. What do you have today?
Harrington. Thank you, Chair Harrington and Board. Good morning. So for you today, I'll start with the numbers as normal, and then what I wanted to focus on for the work session was the work that we're doing to move towards what do we need to have in place to start reopening the county and our community. So share some of the early planning and thinking around that. For the 10 o'clock public meeting, my plan was to provide a PowerPoint that focuses a lot on some of the things that we talked about last week, where we've been, where we're going, and it does include how we're beginning to address some of the governor's components that we need to consider for reopening, but it's pretty high level. So for you all, you'll think, oh, I've heard this, but I thought last week was just extended work session, so the public didn't get to hear some of that information. So that's the plan for today, if that.
The public has access to our audio. What's different is the broadcast.
Yes.
Yes, we're all there with you. I thought there was a prior broadcast that was extracted out of the full board, and I thought that was very valuable to our community. So I hope we'll be able to do that again today.
Hopefully it'll be valuable. So I'll start with the numbers. Our cumulative number of positives in Washington County is 416. That represents 7 new cases since the last report. So we're continuing to see that leveling off or flattening. If you remember a couple of weeks ago, we were seeing more like 12 and 15 new cases a day. So that's good news. We have had 9 deaths, and we have 96 people that have been hospitalized. Many of those have been released and are recuperating. We have had just over 6,000 people tested in Washington County, and that's a cumulative number, which will become important when I start talking about the reopening phase. And we continue to focus a lot of our attention on long-term care centers, assisted living, nursing homes, and adult foster homes. We still have 3 long-term care centers that are considered to be in outbreak mode, meaning they have at least 2 cases that are either in residents or staff. So that's the numbers for today. I wanted to share a little bit of our plan and our thinking about reopening. So Public Health Division and the EOC are working together to really get ready for the next phase of the governor's new orders, anticipating beginning to relax some of the social distancing restrictions. So outlined in Governor Brown's orders or her presentation, I'm sorry, it wasn't orders, it was a presentation on April 14th. She thought that it's important to maintain and advance our efforts to slow the disease. So that's where we are now. And then we would need 3 strategies. We need to ramp up testing capacity. We need to develop robust contact tracing systems to track and contain all cases. And we need to establish isolation and quarantine programs for new cases. So you might think, well, aren't we doing isolation and quarantine now? And I'm going to talk about that a little bit when we get to that section. So starting with ramp up testing. So the current status is we still do not have widely available tests. It's still prioritized for those with more severe symptoms, those at risk of severe illness, or essential workers. What we're estimating is that we would need to double what we're able to do now every week. And then one of the issues that we're still concerned about, it's ongoing issue, is PPE supply. So we're able to provide enough PPE right now, but if we ramped up on all these areas that I'm going to talk about today, we would be concerned about the PPE supply. So our priorities, the EOC and public health priorities are, we're working to get mobile testing in place, especially for the agricultural workers and migrant farm workers as they enter into our community. We're working with our federally healthcare centers, Virginia Garcia Neighborhood Health Center, to really be able to enroll people into OHP quickly, into Medicaid, the state Medicaid program quickly, so that they are able to get health care and testing when they need it. We're also finalizing a contract with Metro West Ambulance so that they are able to provide testing. There's been some changes to their licensing requirements so that they can do that. Encouraging and supporting that the mobile testing sites that are currently operating go beyond the referrals from their healthcare providers and move towards general public testing. And then ensure that systems and resources are in place for rapid testing of contacts once we move into that phase of doing really stringent contact tracing. We'll need to test those contacts. So some of the policy issues around increasing testing is funding for Washington County and for our partners that are implementing these testing expansions, and continue to advocate for adequate PPE for our healthcare systems. So I'm going to move on to robust contact tracing and sure.
This little note, you don't want to get too close.
Oh.
It doesn't pick up.
Usually I'm too loud, so.
No, not you, me.
Or quiet.
You know it's me. Ah, all right.
Okay.
All right, thank you. Even if we want to do all that, which we do, where are we going to get those resources? I mean, you didn't address that. You know, we had these things we have to do, but are the resources even available? And if we are available, where?
Right, so there is increasing resources, and what I would say is that that's the continued advocacy part that is part of the policy solution, because in Washington County right now, we don't have enough. So some of it is the level of our staff advocating with our healthcare partners to open up testing to more general public, but in order to do that, they need all of the testing supplies and the PPE. And that is advocating with the state, and the state, of course, as you all, I'm sure know, are advocating with the federal government to increase the supply. And it's not just the test, you know, the laboratories have the capacity, it's making sure that we have the reagents and all the test supplies. So I don't have an answer. We need to keep pushing all the way up to the federal government to get that resolved.
Just maybe, since we have a question, one other follow-up on the OHP, Oregon Health Plan. Is that something that is available to people, whether they're legal residents or whatever? What's the story as far as residency requirements are concerned?
So,
The migrant workers.
right, for Medicaid, you do need to be a legal resident to receive OHP. There's some exceptions, like Cowan exceptions when you're pregnant. So we are working with Salud Health and Virginia Garcia and Neighborhood Health Center to assure that our migrant workers and our undocumented residents do have access to health care services, including testing, but it wouldn't be through OHP.
Okay, thank you.
Sure. Okay, so I'm going to move on then to robust contact tracing. The current status, Washington County has expanded our disease control team fourfold. We've gone from 10 staff to 40 staff. And we've been using other HHS division staff and other departments. And then we also have systems in place, which might not sound like much, but in place so that we can expand the number of workers that are able to access the state laboratory database, which is amazingly a very complex, difficult database to work with. It takes a lot of support and training. So we're working through that with the state. So our priorities is to begin planning for additional staff as we move back to isolation and quarantine. So as you know, the stage that we're at now is we are interviewing all cases when they're identified, and we're isolating the case. So we're giving instructions to the cases that they need to stay home and isolate from anybody else. But what we're saying to their contacts is everybody is supposed to be staying home and self-quarantining. So we don't have systems in place right now for quarantining all of the contacts. So then,
Excuse me?
Sure.
Can we talk about what you just said?
Yes.
You talked about going back to
Yes.
self-isolation and quarantining. I don't know what you mean by going back, but more specifically, what in these last 6 weeks, 4 of them under the Stay Home, Save Lives order, as you've been here before, you've talked about how folks who have mild symptoms, don't need hospitalization, need to isolate themselves from other members of their household. What is the difference between that messaging and this new messaging of quarantining?
Right. So the biggest difference is before the governor's March 23rd orders, we were doing isolation and quarantine of contacts. And so we were telling contacts, you have to stay home for 2 weeks. And we were supporting that. We were providing basic needs support for that. When the governor's orders went into place, there's basically a community-wide quarantine. And so we were focusing our resources on isolation of cases.
I want to
So identifying the cases, giving them the information, assuring that they're staying isolated. As restrictions are lifted, we have to go back to the strict quarantine of contacts.
I just want to note that as we've each been provided with requests from our public health teams about our phraseology, prior to today, I've been asked to not use the word quarantine. And so now we have a change of messaging. So I think it's incumbent upon us all to make sure that as we are champions for the requests that are being made to members of our community, that we have the opportunity to fully understand what these terms are and to embrace the terms and use them appropriately. So that's why I wanted to make sure that we had the opportunity of Q&A on the use of the word quarantine now. It's a different staging now.
And isolation is, remember, applied to people who are ill. Isolation is applied to people. I remember because isolation is I and ill is I. That's how I remembered it way back like 30 years ago when I was taking tests. So interestingly, the national estimates in order to do this well is that Washington County would need 180, we would need 30, it's 180 staff because they're recommending that you have 30 FTE per 100,000 population in order to do this well. So that's a pretty big number. We all looked at that and went, wow. And so what are we doing to figure out how we're going to get there? So one of the things that we're doing is looking at the current county staff that's been deployed to this and saying how many of them can continue to do this long term versus going back to their normal day job. So that's step one, but that's a very small number. The other thing is that we're working with our local community-based organizations that really represent the demographics of our community, learning more about who's unemployed, what skills they have, and can we match those skills to our needs so that we can employ them for this purpose. The other thing is we are working with the state to ensure that the training and data collection and access to the state systems are nimble and easy to use. So some policy issues that we need your support on for contact tracing, and we'll be working with Eva, Labonte, and Jack because we are going to need nimble HR processes so that we can hire these people quickly. The other thing is working with our local community-based organizations and our county leadership group to identify unemployed diverse workforce with the skill set that we're looking for. And then we will need ongoing funding, so that's advocacy with the state and the federal government. So then the next piece is establishing a quarantine and isolation program for new cases. So currently, as I said, we're only isolating cases and we're asking contacts to follow the governor's orders. So we're providing basic needs to people who have severe illness. So basic needs might be food, might be help with rent or mortgage payments, or ensuring that they have telecommunication available. And then we've also opened the respite shelter for homeless individuals who are ill. Our priorities moving forward is looking at what is the workforce and what are the technologies that we need to conduct daily monitoring of cases. So for example, in our TB program, we sometimes will give a person who has TB an iPad so that we can check in with them via whatever FaceTime or Zoom. So that's just an example. I'm not saying that's what we'll do, but that's an example of technology. We're looking at how can we partner with our healthcare industry to help us with this. Are there any apps or other technologies that can be used? So we're researching all of that. We need to determine what are going to be the basic needs in greater numbers, because we're just coming off of people that have been laid off. Maybe you get to go back to work in some industries, and then public health is coming and saying, well, you've been exposed to COVID, you now have to go home for 2 weeks and stay home and can't go back to work again. That's going to be a really, really tough message to deliver as people start returning to their normal lives. So we want to make sure that we have resources in place to provide food packages, meal packages. The other thing is we have to expand our respite and sheltering needs, because right now we're focused on homeless adults. We're not focused on families, we're not focused on children, and if they're in a living situation that's crowded, or if they're living at a migrant camp, we're going to need places for those people to isolate and quarantine. So we're looking at all those different options. I bet you can guess the policy issues. We need to estimate the financial impact of isolation and quarantine, and we need to seek state and federal resources. We also have a suggestion and would like for the governor and the legislative body to consider providing COVID-19 quarantine financial support for individuals and families who've exhausted their resources from the stay home and save lives. So that's something that we're interested in exploring with the governor. Okay, so that's kind of the public health pieces. What does Washington County as an employer need to think about? So in order to open, of course, we'll need to maintain all of the pieces that we're doing now. Heightened individual hand hygiene, respiratory hygiene, all the things that we've been talking about, face covering, social distancing, cleaning, disinfecting, reducing face-to-face encounters when they're not needed. We need to ensure that our highest risk employees are able to continue to provide or continue to work from home, telecommute. And we need to identify our support, our communities that are most impacted by the disease, the communities of color, older adults, and make sure that they have the resources that they need. And maintain business practices at the county that maintain our social distancing. So what we assume is that Governor Brown will take a measured, logical, stepwise approach to this, probably continuing to limit large gatherings for some time. So schools, sporting events, those kind of things will remain closed. Our EOC will need to maintain some function and some level of staff support, but we hope that that can eventually migrate to operations specific to different county departments. We'll need to continue the public information effort, disseminate timely and accurate information, especially as things change and hopefully in a positive direction, but it may go back and forth at times, so that's going to be really important. Economic recovery, really making sure that we're connecting our businesses and individuals with the county's economic assistance programs, and that as a county, we're doing everything we can to recover our costs through state, federal, and disaster assistance programs. And I think you're going to hear a little bit more about that today. And then continuing our focus on equity, remembering that communities of color are disproportionately negatively impacted by COVID. And the other is that we need to continue, we're starting to explore a FEMA evidence-based program for behavioral health post-disaster like this that's not really counseling, not full services, but standing up some behavioral health services to help people just process the last several weeks and connect them to services if needed. And then we'll need to continue to monitor the healthcare capacity, the capacity for testing, and the capacity for direct care, and as I mentioned earlier, PPE distribution and what our supply chain looks like. On the business enforcement and education, that will be shifting and changing as we relax some of the social distancing. We'll still need to triage the complaints. We'll have to implement new standard operating procedures based on where we are in the process, which means continuous education and outreach with our local businesses. And then we'll also, as restaurants begin to reopen, our environmental health system will get very busy with helping them reopen, making sure that they're maintaining social distance and using whatever restrictions are maintained during that period. I think I've said a lot, we're not flipping a light switch. It won't be restaurants the way it was in January. There'll be differences, and so we'll need to support the restaurant owners and businesses.
I have a question on enforcement. So the enforcement that is in place today, we have a system where people can report and folks deployed from the EOC go and investigate. But in terms of any penalties, citations or whatnot, as I understand it, that is defined by the governor's executive orders.
Yes, and there is the ability to issue citations and fines. At this point, and I actually didn't check this week yet, but at this point, we haven't had to move there. Almost everybody's extremely cooperative the very first time we visit them. I will say, though, that I did talk to our environmental health, the liaison that's in charge of this, and she said it is getting stressful because people are feeling that economic impact, and then they're coming and saying, we know how difficult that is, we understand how difficult that is, we're making progress, but you've had a complaint waged against you, and here's what we need you to do. And she said that's getting more and more stressful and difficult, so.
In terms of how staff moves forward legally, is that based off of county code or state regulation?
So I actually think Brad is
Sitting right behind you.
sitting behind me, and I remember talking about this, but I don't remember clearly enough to answer without.
Well, and it may be a question that you take and we come back to it.
Asking about
Outside of this
enforcement
meeting,
the
that's
business
fine.
restrictions.
Well, so how it will work, it's under state law that we're enforcing these provisions. It's public health as well as criminal, so.
Okay.
Question I'd like to follow up with Brad.
Okay, don't go far. Well, so the last thing I had was just Parks and Recreation, and that, again, it probably won't be a light switch. They'll probably start to open up some of the open spaces more, but there may still be restrictions on playground equipment or basketball courts, those kind of things. And so we'll be working with our local parks and cities to make sure that that also is happening as the governor directs. A lot of this will be directed by the governor, and so we're working really closely with OHA and the governor's office to understand what direction they're planning to go. And I will share this with you because I think that you all can help us with some of these policy issues and uplifting those to the governor and helping the state uplift them to the federal government.
Couple of follow-up questions, too.
I think, yeah,
I don't expect to, do you want to go first?
Commissioner Rogers?
Oh, it doesn't, yeah. Thank you. Quickly reading what the chair had sent us about 15 minutes before we entered this meeting, and this is from the governor regarding reopening, and this is stair step. The reason I asked you the question I did on the PPE is one of the very specific things in this, transmission of information from the governor says that vote of the county governing body certifying PPE for first responders is sufficient. This is on the phase 1. In my world, when somebody says certify, that's pretty serious. And so Brad, I'm worried, and you don't need to answer now, but I think it's something we ought to really keep in mind. If we're certifying that the PPE is there to get open, is it opening us up to significant suits and liability if someone gets sick and said, you didn't have sufficient, and how did you come to the conclusion? How did you certify? What's the mechanism to do that? So I'm a little concerned that we're getting pitted maybe against other counties who are very small and might have a lot of equipment versus us who we're very large and may not have it, and yet we're being asked if we're going to open up that we certify.
I mean, the liability piece is a Brad question, but what I can tell you is in the EOC, so we receive an allotment from the state and we track how much we get. We get requests from first responders, EMS, law enforcement, behavioral health clinics, everybody. And then, and I actually don't know where they landed. The state wanted us to get a daily burn rate. We were trying to push it to a little bit less than daily because some of those organizations, it's really hard to track that. So, but we are tracking how much we receive, what goes out the door, and how quickly they're burning through the PPE that we're providing. I would not feel comfortable today coming to you and asking you to certify that we have enough and that we will have enough moving into the future. So I think that that's something that we would have to feel really comfortable before we would come to you and say, we can look at the trends, and so far we've been okay, but a lot of organizations had stashes that they burned through, and so I think that we need some more time to watch that.
Yeah, and I think we would push back on the use of the term certification. That's troublesome as well, yeah. Because, as Marty said, there's a lot of unknowns built into that, and I don't think we could definitively certify that we have enough PPE. As you know, some of this is being reused, and as we go further on, we would probably want to not be doing that. So it's a good point. We'll really push on that issue.
I would suspect you'd want to be looking at the various immunity clauses as well, discretionary immunity and that kind of thing.
Well, of course, yeah.
Yeah. Couple of pieces I haven't heard, and I don't necessarily expect a response just right away on this, but I haven't heard about the jail. Obviously, that's always a concerning population, both staff and the inmates. And then number two, as we look towards opening, I'm really alarmed by what's going on in other parts of the country. There's states that have had no program in place really to really effectively quarantine or to sort of eliminate or at least mitigate some of the social contact, social distancing. Malls are being proposed to be opened. That are like right on a couple of major interstates. So what are the implications? I mean, I don't think we can divide ourselves off from the rest of the country. What are we doing in terms of, unfortunately, this has become very politicized, unfortunately, and we seem to be working at cross purposes. How will that be factored in?
Yeah, I think that, we need to continue to watch our cases go down. There's been different ideas out there about what the rate should be, so the number per 100,000 over time. So I don't know exactly what our target will be at this point. And I haven't seen the governor's slides yet, so maybe she threw out a suggestion. But I think one of the things that I've appreciated about Oregon, Governor Brown, and our tri-county elected officials at all levels, your board, the other boards, as well as a lot of our city officials, is everybody is really committed to understanding the public health science and the public health recommendations and making decisions based on that. We're not going to close our borders, I don't think. So I think we're always going to be concerned about imported cases, but that's where we need to get to the level where we can do robust case finding, isolation, and quarantine, because we can't necessarily control what's happening in states surrounding us or even communities around us.
No, we actually have very little control over that. We only
Right.
have control as a county government within the jurisdictional lines of our county. But just to put things in perspective, and I'm sure you're probably more familiar with these facts than I am, but one jail in Ohio has roughly 3 times the number of COVID cases that we have in this entire county.
And for some reassurance, our sheriff and their staff have been doing a fabulous job, and we have no cases in the jail as of today,
Right, right.
as
Well,
of
and
this
actually, my
morning.
comment is less in reference to our jail. My concern is there, though, obviously, that's always going to be a concern, but it's just more putting things in perspective in terms of what's going on elsewhere in this country. We can't not be unmindful of that, and some of these meatpacking facilities and some of the jails have got COVID cases that are double or even 3 times the size of our entire county that we know at this point of COVID cases. So it's pretty alarming, actually.
Any other questions from commissioners at this stage? So we do have some other updates that will be coming in both through this topic. Alex, if you could come up to the table, as well as a part of it through our legislative update. As Marnie talked about during the legislative update, we're going to be going over the 2 different memos that you have in front of you, hard copy, one of which relates to recouping cost. The other is the idea with regard to gas tax proposal under House Bill 2017. And I know we also have some follow-up items from our staff, particularly around community corrections, state prison, that I'd like to get an update from our staff on sometime. But without further ado, the Business Assistance Program.
Madam Chair and members of the board, Alex Vidal for the record. So last night I sent an update, a status update on our program. Just wanted to provide an informal brief to you guys now. We received, so we opened up the program for applications last week, Wednesday at 8 a.m. And we held it open for 2 full business days until Thursday at 5 p.m. We received over 2,200 applications. For context, there's a little over 20,000 small businesses in Washington County, and so that's around 10% that applied. We are going through our selection process now, and we'll have a final list hopefully either end of today or early tomorrow morning, and we'll begin processing the grants through our CDFI partner. Once we have a final list for the grants, we will move on to the loan portion and begin the selection process for the loans.
Could you describe for us, this program works with the CDFI. So in terms of the application review and then getting to the actual funded, what sort of steps are there to go through that? You just described a selection process and then in partnership with the CDFI. So could you speak more about what's involved there?
Absolutely. So our 3 strategic goals for the program were to make sure that there was equitable access for historically disadvantaged business owners, that there was a geographic distribution that was closely aligned with the actual small business distribution across the county, and then that there was a reasonable distribution among firms of different sizes, different employee counts. So what our strategy has been is to ensure an equitable outcome. We were recommended a level of 50% from set aside for the historically disadvantaged community members. So that includes minority-owned businesses, but also women, also the disabled, veterans, various groups that were included in our equity resolution. What I did was I pulled together all of the applications that requested a grant. So some requested just a grant, others requested both a grant and a loan. Everyone that requested a grant was eligible. We used a random number generator to pull selections from that list for the first 50, and then from the second 50, it was a combined list of all of the applications that applied for a grant. So now we're looking at the geographic distribution. There was a little bit of some concern. We thought that there was very few that had applied from the unincorporated area and an overrepresentation from some of the larger cities. But luckily we had Chris Defebach and Cannon, I can't remember his last name, from LUT, actually plot the addresses of the selection, and it turns out that a lot of the folks that had selected Portland or Beaverton were actually in unincorporated. So now the numbers are looking a lot more like they like the actual distribution of small businesses. So the third lens that we're going to apply is the firm count, employee count rather, to make sure that we're have a selection of businesses that represent the proportion of small business sizes based on employee count.
When you talk about we are reviewing this, are the two CDFI partners that are under contract with this program, MISO and Craft 3? Hopefully I got that name right.
Yeah.
Phew. Called them Center 3 for like 2 weeks. Are they part of that review process?
So MISO actually created the application form for us and all of the questions that were going to be asked, and they helped us develop guidelines for the program, so they had input, so did Craft 3. We've been continually asking for their input on the selection process and how we do that, so they have been part of that process. And then once we have the list of selectees, they will be processing the MISO will be processing all of the grants, and then both organizations have their own underwriting criteria, so they'll have to walk the applicants through that process to make sure that they meet those criteria as well.
See, that's the nugget I was trying to get to, understanding that process. Thank you. So our two commissioners who've been providing key leadership.
I just wanted to provide one clarification there, and that is that, yes, they put together the application, but it was under the guidance and the focus of the team here. So they did the actual putting it together, but we determined what the criteria was and did that together. So, and it's really been fascinating to look at the number of businesses that we're looking at potentially being able to support, and it's very diverse. It represents the entire county, and it represents a variety of types of businesses as well. So I'm really pleased with the process. I'd like to point out that we've had some calls. We've had some people concerned about issues. Commissioner Willie and I have been fielding those calls as well as others. So we've been trying to make sure that people understand what the process was, and during that contact, there's been a positive resolution. I think the one thing that's nice to offer to our businesses that didn't get in on time or didn't complete their application, should I take it off? Okay, just for a moment here. Thank you. That didn't complete the application appropriately is that we've talked to them about the fact that we're have a contract in place with Work Systems, Inc. for them to be able to navigate the state and federal opportunities as well. So that's a nice opportunity for them as well. Commissioner Willie?
No, I think you covered it pretty well. It's been a rigorous process, and what's pretty amazing is the capabilities that our staff have. Like yesterday, when we were having this issue of geographic disbursement, and Chris said, well, I think we can do this, and so we gave her 100, the first 100 applications that have been made through the random generated selection, and she got that information back in a huge graph form package yesterday afternoon. So it's amazing what our staff can do, and I think everybody's been really on board. And this process, I think, is going to be probably, in my own personal opinion, is going to be one of the better, I think, conceived and processed loan and grant things that have been gone on through the Tri-County region, just because we've learned from others and we've improved upon it, and the staff has certainly had a lot of input. So it's been a great process, and I'll be happy for the first set of checks to be written, and we can certainly move on to that loan process and kind of putting the wraps on at least phase one.
So towards that end, I'm hoping that in the future you'll have a presentation that talks about the number of applicants, how the process worked, the number of selected, and so forth. So what is your plan for a plan?
I'm going to kick that over to Alex.
Madam Chair and members of the board. Like a lot of folks now, we're building the airplane as we're flying it, right? And so right now, we're trying to get to the end result of getting some assistance out to the community, but we're also working backwards too to make sure that we're providing you that overall broad, detailed, definitive information about applications received, eligible reasons folks didn't qualify, the breakdown of the selectees and the applications that were received. We're going to have a lot of detailed information for you. It'll just, right now, our focus is on getting the resource out.
Absolutely. 4-week timeline, 2-week timeline? It's just a target.
Right now, honestly, we were just trying to keep pace with everything that's happening. We're also looking at the reopening phase and everything that's happening there and trying to stay current on that information, making sure that we're coordinating among the different work groups that have an economic tangential focus.
I think it's fair to say that we are working right now, and you will get information about the selection criteria because we anticipate that there are going to be a number of people with questions of all of us sitting around this table that did not get selected. So we want to make sure that you have the accurate information ahead of time. So at a minimum, you'll be able to answer any questions that get directed to us as commissioners. And that will be within a week.
Yeah, and I would think that, as a part of that process, because as Pam said, we have fielded a couple of phone calls of some businesses that didn't make the 5 o'clock deadline on the second day, and they were upset about that. So when we called them, they were very gracious, but we walked them through the communication process that we had put into place with the CBOs and with the chambers and with other organizations to try and get this word out in advance. And so they were very appreciative of, certainly, of the efforts that we had done, and they had just, at least the two that I talked to, realized that they just got into the game late. One of them hit the button at 5:10, and it locked her out because 5 o'clock was the deadline. So anyway, it was a little bit of a lesson learned on their part, but I think in the analogy that we'll provide, and I'm going to say in the next 2 or 3 weeks, I'll just toss it out there, that we can, we'll try and bundle this together into a package and kind of walk the commission right through the process that we've gone so that you can understand all of the boxes that we checked along the way, and certainly the analogy that has gone into this. It's been a huge project, and it's been a lot of fun, but I don't know that Alex would say that. He spent 8 hours on Sunday compiling the information to get ready for our 9 o'clock Monday morning phone conference. So I'd say I've enjoyed it, Alex, but I wasn't working all day Sunday either, so thank you for that.
And what I'd like to point out, in addition to what Commissioner Willie said, is I think that there's 2 types of information that you're going to need. One is to address any questions that you have as the applicants receive their grants and or their loans. And then number 2, an overview of the program, how it worked from start to finish. And so I see it as 2 separate pieces as well. So I want to make sure that we are all fully prepared and have our talking points and have our FAQs ready once this rolls out.
I remain hopeful that in another 4 weeks' time, we can have a more illustrative picture of what the program is, where it stands at the moment, and how it's moving forward. I think you're doing tremendous work. I know you're doing tremendous work, working very hard to get applications and get dollars out to appropriate community members. And just having a target, a stake in the ground of maybe 4 weeks out is something to aim for. And as you work through the steps in the program over the next couple of weeks, I think you'll have a better feel. But at least there's a guidepost there. So keep going. You're doing great in trying to make sure that we have assistance to really meaningful organizations here in our community.
And that's one other thing I'd like to point out, and that is the development, the continued development of the relationships with our CBOs in this community. That's a value piece that we haven't really talked about as much in this room, but I intend to make sure that we talk about that moving forward. I think we have, in the economic development world, developed a relationship with those CBOs that did not exist before. So I'm pleased about that, and I think that that brings great value to the commission and to the county as a whole. And also, I'd underscore what everybody's already said. We have an amazing staff. So, but I will say that we did a great job of pulling the right people together and the right team. There's been a lot of hard work, but there's also been a lot of passion around doing it the correct way.
Well, and just to add one more thing, today at noon is a phone conference that Mayor Wheeler put together to talk about economic development around the region, and Washington County is not represented. And the reason why is because they didn't realize we had an economic development team. So again, getting this word out, this loan process, and all the work we've done will help, I guess, bring attention to the region that we are players in this arena, and certainly have amped up our game over the last several months. So we're moving ahead, and this will certainly help us get there quickly, I think.
Well, I just salute our two commissioners here to my right and the staff, their leadership and the effort, imagination, creativity, passion, hard work, so, and the staff as well. So kudos to all of you.
Thank you, Dick.
Yeah.
Thank you.
Yeah, I'd chime in by saying the same thing. Good work. The difficulty, I think, for some of us is it happened so quickly that we didn't know the parameters. We didn't know what was really occurring. So I agree with the chair's position that we ought to have some at least general understanding, because we do get asked questions, and we have not maybe a lot of good responses. The other thing that will be curious to me, and it'll be probably curious to all of you as well, is for many small businesses, I'm not sure, even with the assistance, that they're going to open. I mean, the SBA statistics, as well as pick up any business book, and you'll find that 80% of businesses fail in the first 5 years. And I know you had a one-year criteria to start. It'll be interesting how much money is used to simply pay bills to try to open, and whether they'll get to open. But this is a marvelous start. I commend everybody. I think it's great. It'll just be very interesting to see what the outcome is.
Madam Chair and members of the board, so we are doing our best to make sure that the board members have the information that they need to respond to public inquiries about the program. Just a reminder that some of the other jurisdictions that have done this have whole departments that are doing this, and there's just a handful of us doing this work. But we are trying our best to get that information to you. On the one-year point, that was one of the main issues that was raised by folks that had a concern, was that that they started their business 3 months ago or 6 months ago or 9 months ago, and they felt that a one-year cutoff was arbitrary. And so, but at the same time, we were balancing that against a low barrier to make sure that we were getting help out to those that needed it. And so we landed on 1 year.
To give you a snapshot, the reason why we left the application process open 2 days is we wanted to get a better understanding of what the real demand was out there, because Beaverton and Hillsborough and Tigard, I think, opened and closed on the same day because they were just overwhelmed. It was a first in, first out process. We committed to not doing a first in, first out, but we also wanted to find out what the real demand is. So when you take the 2,200 applications we got in 2 days, and you just say, we're going to give every one of them a $3,000 grant, which really isn't a lot of money if you've had to close your business, it's still $5 million. And we don't have anywhere close to that in the game right now. And so the demand is huge, and we're just trying to help move along the dial a little bit, but you can understand 2,200 applications in 2 days, and I would imagine we might have even doubled that had we left it open for a week, for example. So, yeah, huge demand.
Alex, could you please mention the number of applications that were submitted in different languages?
Try to find those numbers. I don't wanted to, I just wanted to mention one other thing as well, not take up too much more time, but that is that there was a number of additional questions beyond our minimum eligibility that were asked on the application, and so we're going to be able to analyze that data and provide some additional information about the needs out there from our business community. The application was also we partnered with Apano, so we had the application translated into Vietnamese and Chinese, and had some Apano provide technical assistance to applicants that spoke those languages. We also partnered with Adelante and Centro Cultural for Spanish help, and so there were 53 applications in Spanish, 3 in Vietnamese, 11 in Chinese, and then MISO was able to translate the application into Hindi as well. So making good connections there with our community-based organizations.
So we've had some really positive indications right from the beginning, such as the numbers that you sent us last week and articulated here today, the number of applications. And it's an amazing body of work that you've been able to put out, solicit, and receive based upon the stretched capabilities of the whole organization. I mean, with our communications team, our team of 2 is really stretched to make sure that they're servicing our public health departments, working with PIOs from across the region to make sure that all the first responders and all the right messaging is out there. So all of the strides, all of the results that you've achieved over a couple of weeks is astonishing. It's tremendous. I want you to keep going. But I hope we're not asking you to keep going with this starved level of resourcing, okay? For the kind of questions I was asking about and hopefully needing, I was trying to position that no pressure, just put a marker out there that feels achievable, okay? Don't add pressure to yourself, but just put a marker out there so that there is a way for folks to say, I know it's coming. And hopefully in this time frame. And in 2 weeks' time, if we find out we need a little bit more time, then you just reset it, okay? Make it achievable in a way with the resources we have. That's all. You're doing great work. Keep it up.
I'd just like to add also, there's some people that have been a little bit behind the curtain. You know who our team is, but we've also had tremendous help from Melissa DeLizer in communication. Melissa was she had a vacation day planned, and she was on point working with us all the way along with Philip and others. So the interest level in the staff to be able to participate and support has been very, very high. And, you know, I'm stunned by the groups that have been brought together. Erin Doyle, Chris Deffabaugh, people that I wouldn't have initially thought of in relationship to economic development. So again, we have a lot to be proud of here.
Madam Chair, members.
Thank you for your comments, Chair. Thank you very much.
In closing to that point, opening day, we fielded a lot of calls, a lot of emails. It was a small percentage compared to the overall applications, but Janet Long in the County Administrative Office fielded calls. I think Angie did as well. Kathy must have as well. Brad from County Council has been helping us with contracting. Susie from purchasing. The list goes on and on. The organization has come together for this project.
Thanks,
And
Alex.
thank you, Steve, for your help too.
Terrific. Thank you. So as noted, we do have some other items to discuss related to COVID-19, and some of them under the legislative update. We are now at 10 minutes before the hour, and we have a business meeting at 10 o'clock, and we generally find it goes best if we take a break in between. So I would suggest that we pause our work session at this point and pick back up with our scheduled 1 o'clock timing. And, or gee, it would be nice if our business meeting goes very short, if we could reconvene, but since we're now in this whole Zoom world, I don't know if we can or cannot reconvene. We have to keep the schedule. I'm getting indications we have to keep to the schedule. So we'll pick back up at 1 o'clock in our work session and start off with the legislative update.
Madam Chair, I believe we have an outside speaker coming at 1 o'clock for the presentation.
Okay.
And so it would probably be best to put the legislative update after that presentation.
All righty. Shall do. Any other questions or comments for now? All righty. So we'll pause here for our work session and reconvene at 1 o'clock. Thank you.
We'll stay in place. Cool.
Yeah, Chuck?
I'm doing great. How about you? Feeling better? It's hard when you get that, breathing issues. Age?
We're going to move.
Yeah. What's the cure for that? I think so too. I think so too. Can you get us down here okay? We should have done that the other week. Yeah. Someday, maybe.
The Board of County Commissioners of Washington County, also serving as the governing body of Clean Water Services and all other county service districts, is now meeting in regular session April 21st, 2020. Commissioner Willie. Commissioner Rogers. Commissioner Treese. Vice Chair Scouten. And Chair Harrington.
You'll see that we have a new setup today. In order to practice physical distancing and hold our meetings. We are down on the floor, so to speak, versus behind us up at the dais, so that we are all within camera view and here together. We're still figuring out some of these logistics, so we've got to make sure that the monitors are available to commissioners to view the presentations that we have coming throughout the remainder of the meeting. We're also using Zoom for the purposes of our Board of Commissioner meetings so that members of our community may attend the meeting virtually, but we also have means to accept public comment. So at this stage of the game, moving on to oral communications. Ms. Jacoby, how many people have signed up?
At this time, I have none. If there's anyone who's joining us virtually, you can raise your hand, and I will call on you. And I'll give you a couple seconds to do that here. I see no one raising their hand, so we are free.
Okay, we do have a second opportunity for oral communications later in our agenda. So there are some agenda announcements that I wish to make or need to make. Item 2B from the consent agenda, authorized transportation development tax annual index adjustment, is moving to be the second item under section 7 action. So we'll take that up under the action item. There is also a change to, two changes to the consent agenda, one, and that is the minutes for April 7th are part of the consent agenda, which is a change from previously. And let's see. Yep. And then on item 7A, which is under action, we had an update to the topic sheet for that, and we'll go over that as part of the staff report for that item. That's the summary of changes to today's agenda.
Move for approval of the consent agenda as modified.
And today's consent agenda consists of two sets of minutes, one item under Clean Water Services, two items under Land Use and Transportation, one under Assessment and Taxation, one under Health and Human Services, and one under Service District for Lighting. We have a motion. Do we have a second?
Second.
We have a motion and a second to adopt the modified consent agenda. All those in favor, please vote by saying aye.
Aye.
Any opposed? The motion carries unanimously 5-0. Next, we have a presentation on
hospital, but they need a safe place to rest and recuperate. And then I'm going to talk more about our work and our equity work. I also wanted to highlight county administrative services. So the county is also an organization who employs somewhere in the neighborhood of 2,000 staff. And so the county has very quickly looked at our human resources policies and really put policies in place that help our employees to stay safe, stay employed, and to do their jobs. A very high percentage of us are able to do our jobs by telecommuting now, staying safe, but serving the public and making sure that essential services are open for helping our community. We also have Chair Harrington, who's done several PSAs for us. Thank you, Chair Harrington. The most recent PSAs you did were not letting our guard down, and that was viewed by over 1,200 times, at least when I checked the other day. And then also recently you interviewed Dr. Christina Bauman about how do we use our facial mask, our face coverings, and that was viewed over 900 times. So all of that helps us to get the message out about staying safe and protecting ourselves and our friends and family. The county communication specialist, Philip, has put Q&A for all of our employees so that they're getting all the latest, greatest information. Our support services has jumped into action because in order for our staff to telecommute, they needed to be able to take laptops home and have access to our files and our information here at work. And the county, when CDC came out with the recommendation for employees to wear face coverings when social distancing is not available, the county jumped on it right away and ordered and is beginning to distribute face cloth coverings for our employees. So thank you to our county administration for helping us in this response. Okay, so now I want to talk about, we can go to the next slide. So where have we been and where are we going? I'm going to tell a short story. It's a little bit of a walk down memory lane, only this memory is only about 2 months old. So where we are today and what does our future hold? I'm really using our communication plan to guide this story, so I want to make a special thank you to Wendy Gordon, who has led our communication strategy since late in February. I'm hoping that you'll get 3 main messages out of this quick walk down memory lane. First message is we had the first case in Oregon, and what does that mean? What does it mean to be first? The second is the importance of incorporating equity, which we have tried to do since day one of this response. And then the last thing I want to convey is what do we need to move towards our new normal? So I'm going to start with a timeline. So we can go to the next slide. So as I started this, I thought I had the timeline on one slide. And then I realized, oh my goodness, so much has happened in 2 months. So this is very high level, just to give you an idea of what's been going on. A reminder, we've all been living through this. February 28th was when Washington County was notified that we have the first case of COVID in our community. This case was not linked to travel or any known risk factors. So what that told us is there's already community spread. We knew now the virus has been circulating before February. March 3rd, we activated our Emergency Operations Center and really focused on slowing disease spread. March 4th, Washington County Board of Commissioners declared the first declaration of emergency. The state of Oregon declared emergency on March 8th, and the United States on March 13th. So again, we were first. March 11th, the World Health Organization declared COVID-19 a global pandemic. Next slide. The beginning of our restrictions, in case you're wondering why it feels so darn long, and I agree. March 12th, the governor banned all large gatherings of 250 or more. On March 17th, they banned gatherings of 25 people or more, and on the premises, no food or drink consumption. So you had to only have curbside pickup or delivery of food, restaurants basically closing. And then orders to close schools until March 28th and included higher education beginning on March 19th.
April 28th.
April 28th. Stay closed until April 28th, yes. So March 23rd, stay home, save lives, the governor's executive order that we've been living in since. And this is really working. It is flattening the curve. OHA has estimated that this March 23rd order that we're all following, we're all staying home to save lives, has prevented as many as 18,000 COVID infections. April 3rd, CDC releases guidance advising non-medical face coverings when in public. And we've been wearing our face coverings, but right now we're very socially distanced, and so many of us don't have it on. And then April 8th, the governor extended school closures and higher education closures through the end of the year. So that's a lot that's happened just in a couple of months. So I'm going to move to what does it mean to be first? So in a lot of our outbreaks that public health has to address is something like measles or salmonella or shigella. They've been around for a long time. We have protocols. We have standard operating procedures. We have standard interview tools. We have standard public information tools. We have standard information that we provide to families who are infected, maybe, say, with measles. You might remember that a few months ago. So this was a novel virus. That means we don't have very much information. We don't know a lot about the infection. We're looking at what's happening in China. We were looking at what was happening in South Korea, in Europe, trying to learn from that. But being the first case in Oregon, we had to develop case interview protocols. We had to develop plans. How are we going to quarantine contacts? How are we going to isolate cases? What if their family is large and the person that's sick doesn't have a place to isolate from the rest of the family? What are we going to do for these families that don't have an income now for 2 weeks? And now it's 4 weeks because somebody else became sick, and now it's 6 weeks that they have no income. And they're being told they can't go grocery shopping, they can't go out of their house. What is the education that we need to provide? How do we provide that in different languages? What does the public need to know, and how do we provide that? All of that, Washington County had to develop. Of course, we had support from our partners in neighboring counties who didn't have cases yet, and we had support from Oregon Health Authority, but we started it. We had to develop all of that. Okay, we'll move on to phase 1, where we started. We also needed to address the social and economic needs of those impacted, both the cases who were isolated and contacts who were in quarantine. So this was about slowing the spread of the disease. We had to interview all the new cases, perform contact investigation, identify people, and give them instructions on how to stay home safely. Equity was really important during this time. At the time, there was a lot of stigmatism and racism, and there continues to be concern around that. People didn't understand, where did this come from? Why are these people sick? What did they do? And so we really had to address that. We had to do that by understanding who our cases were. We had to protect not only the individuals from stigma, but communities from stigma and racism. So that's why in the beginning, we weren't providing a lot of demographic information or data, and people didn't understand that, and they were concerned about that. But it was really about protecting individuals and communities. It also meant sharing information about signs and symptoms of the infection at the time, testing information, when to seek health care, and how do we provide that in several different languages to several different cultures in a way that they could hear the information and understand the information. In order to do that, we needed to rely on trusted community partners and our social media help for these early messages. So then we moved on to what we're calling phase 1A, slow the disease, gain knowledge, and educate the community. We had public health nurses, our health officer, and others that were continuing to work 7 days a week to identify cases, interview the early cases, and provide contact tracing, including notifying work sites, and providing information to the public about how the disease was spreading. Around equity, with the new recommendations, at this point, we had new recommendations from the governor around staying home, saving lives, and then eventually the recommendations around face coverings. So we had concerns that were raised. People from communities of color told us, we don't feel very comfortable wearing face masks. And so we had to work with communities to make that more, to raise their comfort level, to understand what the concerns were, to communicate that to their neighbors and their friends, and to help local law enforcement, because we knew that there was bias reporting happening. We had reports of it into our office. We had reports of things like families who had positive cases, or somebody assumed they had a case, that were put on neighborhood watch lists. We had cases of people walking by Asian families and throwing masks or cloth coverings onto their porches with slurs. So we were addressing all of those kind of issues that we were seeing in the community. And again, we couldn't do that alone. We had to rely on the help of our other community-based organizations that work with these populations. We also had to continue to monitor the data and identify disparities. And so some of our communication and our work has really focused on communities that are more impacted by this. So we're getting more and more information out, again, to migrant farm workers, to the Latino community, because in Washington County, they have been more impacted. We also had to continue to deliver food. We provided hygiene supplies, and ensuring that the information was provided. So phase 2. So we haven't really yet begun phase 2. We're heading towards phase 2, but we're not there. So phase 2 is really about looking at the social distancing measures that appear to be working and making sure at this point that we stay strong and continue these strategies, that we stay connected socially, but that we stay distanced physically. We're also now focusing, this has been a long time. A lot of us are tired of this. A lot of people in our community are really suffering. They've lost jobs. They've lost contact with loved ones. It's not the same to FaceTime. I know from experience, it's not the same when I FaceTime my little 3-year-old granddaughter. That's not the same as when she came over and we could hug and kiss and dance and sing together. So we understand that this is really hard, but this is where we are. We're in phase 2 of really needing to stay strong and move us towards relaxing those restrictions. So the final phase will be really led by our governor, and she's the one that will help us with the roadmap, and we're working together with Oregon Health Authority and with the governor's office to identify how do we assure that we have testing available for anybody who wants it. How do we assure that our public health system is strong and sustainable, and that we can isolate, we can do case investigation quickly, we can isolate, and we can quarantine anybody that's been exposed to somebody who's sick. What we ultimately have to work towards is herd immunity. And herd immunity is really an estimate of at least 50% of our population being covered with a vaccination. It means that people won't be as susceptible to this disease. In the meantime, we are going to have some restrictions in place, but we are beginning to work on a plan for how do we move towards loosening those restrictions, making sure that we have adequate testing, isolation and quarantine, and that we can rapidly ensure that people have access to health care, and if they do become sick, so that we have an adequate health care system. The other piece that we'll need to do is make sure that we begin, and we're starting to work on this in both the public health arena and at our emergency operations center, and all of our elected officials, including this board, are beginning to talk about what does the economic recovery look like as well. So we have the next slide. We have received federal and state criteria, and most of that I've mentioned already. Really more testing capacity in every region of the state. We need to continue to see the decline in positive tests. We need to be able to provide safe quarantine and recovery locations, including for families, including for our migrant visitors that are coming into our community. We need to assure that there's adequate personal protective equipment, and we need to be able to trace all of the close contacts for anybody who tests positive. The White House has also released similar criteria, and the governor is looking at how that criteria would be applied in the state of Oregon. There's important criteria that has to be met before we can start loosening those criteria. And the way that we're going to get to that is my last slide. The way that we'll get there is by continuing to stay home and stay safe. So again, this is the last slide. We're still in this stage. And by folks really complying and cooperating with this just a little bit longer, we need you to hang in there. That's what's going to move us toward the criteria of fewer people becoming sick, fewer people hospitalized, improved healthcare capacity, and the ability of our public health system to do case interviews and isolation. That's what's going to move us out of these restrictions. And that's what I have. If there's any questions, I'm happy to answer.
Commissioners, do you have any questions or comments?
I'd just like to say thank you again.
Thank you.
Might point out, the reason there's not lots of questions, we just had about an hour briefing
Yes.
right before we started the meeting, and it's just as good. Thank you.
Thank you.
Any other commissioner comments?
Well, I think my only other comment, this is more on the legal side of things, is that state lines are not just administrative lines for the federal government. One of the first things that you'll learn in constitutional law is that the state and the federal government are supreme within their respective spheres. And there is a considerable amount of independent sovereignty with respect to police powers in terms of public safety, order, and what we kind of colloquially call the police powers. And so it's important for the federal government to play a coordinating role, and we need their resources and their fiscal capacity and their ability to put out significant funding without having to be concerned about the balancing budgets. But we have to respect the fact as a county, as a subdivision of the state, that we have obligations that we're going to have to meet to meet with state mandates and state executive orders.
Right. The executive orders that we're following now, the stay home, stay safe, save lives, is an executive order of the governor, and the governor is the person that has the authority to lift those orders. What I will say is that I've been really pleased that our governor is really paying attention to what is the public health science and balancing that with the needs of our community, and really thoughtful and collaborative. Oregon Health Authority, the governor's office, and our local and regional, really, because we work regionally in the metro area, we're all working together to understand how can we move towards lifting these restrictions and what do we need to have in place? Because it's easy to say you need more testing, but how do you get there? It's easy to say we need to do more isolation and quarantine in our public health system, but we need the staff and the resources to get there. We need to be able to support the families who would fall under that isolation and quarantine orders. So yes, the governor is the one that will lift the restrictions, but she is doing that in partnership with local counties and public health.
Any other district commissioner comments? All right. I would like to add to our community members, you've done really, really well. You have helped slow the spread of this virus. You have helped buy some time so that our healthcare facilities, our first responders, our communities have been able to be better prepared. We've certainly learned a lot since this virus has joined us here in the community, or we can verify that it joined us in our community on February 28th. We've learned about the transmission occurring through droplets, and we've learned about practicing physical distancing and social connection. As we've heard today, we're trying to get to phase 2, but we're not there yet. We have more preparation to put into place, and that is preparation that we each need to do as individuals, as families, as employees, as employers, and as community members. We have some time now to sort out what it means for each of us, individually, as families, and collectively, to live with COVID-19 in our communities. It's here to stay. But what do we need to do to continue to sustain physical distancing? Because until we have a virus, it is a tool and a technique that we're all going to have to rely upon. You have much to feel proud of. For 4 weeks now, since the Stay Home, Save Lives executive order has been put in place, you've helped slow the spread. It's been 5 weeks since parents have had to adjust to not having schools open for their children to go to learn each and every day, and to interact with other kids of their age, and to have those activities, and for them to work out the wiggles in their bodies. As we look ahead, the end of May is only 6 weeks away. So while we have 6 weeks behind us in the rearview mirror since February 28th, and other milestones, we still have preparations that we need to make. We still individually, as community members, have needs to prepare. We're going to have to experiment along the way. What are you going to do to help sustain your living with this virus? What is your family going to want and need? What are you as a family going to look forward to through the course of the summer and through the remainder of the year? We can do this. We have this within us as individuals, as work groups, as employees, and as employers. We've done tremendously well together. I am certain that we can continue to thrive as community members in the weeks and months ahead. Please stay well. Think about what you can do. Put together, brainstorm some creative lists for yourself, and let's keep going into a safe future together. Thank you, Marnie, for all that you do to help us learn and to embrace the fact that we are living days ahead of us with this virus as part of our every single day.
Thank you. Thank you, Board.
Next, we'll move on to item 4 of the agenda, to proclaim tomorrow, April 22nd. It is tomorrow, to be the 50th anniversary of Earth Day. I remember the first anniversary of of Earth Day. I was a young child. So it looks like we have a staff member who will do the honors of a staff report and perhaps reading the proclamation today.
Hello, good morning. Thank you, Chair Harrington and Commissioners, for allowing me to take a little time on your agenda to help recognize the importance of the 50th anniversary of Earth Day. My name is Robin Strawn, and I am Washington County's Sustainability Coordinator. Washington County recognized the importance for environmental protection and supported sustainability efforts long before my program was established in 2009. The county values leadership in sustainability as a reflection of effective public administration, the health and well-being of our community, and concern for future generations. I would like to acknowledge the hard work that county employees do daily to ensure that we minimize our environmental impacts, build a responsible organization, and plan for the best possible outcomes for the community. My program recently completed our annual report documenting progress on county sustainability work. And while we had hoped to share it today, we look forward to sharing it with the board when you're ready to hear from us in the future. Many county departments have programs and projects that help protect our environment and support sustainable communities. In fact, we had 10 different county programs signed up to join us for an Earth Day mini fair before we had to cancel it to follow the requirements for distancing. Nevertheless, the work we all do is important and vital to the long-term resilience of our organization, whether it's improving the efficiency of county buildings or the fleet, helping to reduce waste, providing access to active transportation options, or helping residents upgrade home heating to improve air quality. The county has made great progress in reducing our own environmental footprint and is committed to doing more. Therefore, I am pleased that we can take the time today to formally recognize the county's commitment. Are there any questions or comments before I turn it over to Kathy to read the Earth Day proclamation?
I don't see any.
Okay.
Why don't we move on to reading the proclamation?
Okay, then. A proclamation in honor of Earth Day, 50th anniversary, April 21st, 2020. That's today. Whereas Washington County's mission includes supporting healthy, peaceful, safe, and sustainable communities, and whereas Washington County recognizes the role and responsibility for public agencies to protect and conserve natural resources, use financial resources effectively and efficiently, and celebrate the achievements of a healthy and productive organization. And whereas Washington County recognizes the need to carefully consider the impact of our decisions and behaviors so that we not only have a healthy, vibrant, and safe community today, but also preserve the viability of future generations. And whereas Washington County is committed to building upon and expanding its sustainability initiatives and practices. And whereas the first Earth Day on April 22nd, 1970 is credited with launching the modern environmental movement, and whereas environmental protection and natural resources are of special importance to Washington County residents, agriculture and industry driving community well-being and economic success. And whereas both the progress to protect and improve our environment over the last 50 years, as well as the challenges ahead, such as climate change and environmental justice, must be acknowledged, now therefore be it resolved that on this 21st day of April 2020, the Washington County Board of Commissioners does hereby proclaim April 22nd, 2020 to be the 50th anniversary of Earth Day in the United States, and calls on the people of Washington County to observe this month with appropriate programs, activities, and reflections.
What are the wishes of the commission?
So moved, Madam Chair.
Second?
We have a motion and a second to adopt this proclamation proclaiming April 22nd of 2020 to be the 50th anniversary of Earth Day. All those in favor, please vote by saying aye.
Aye.
Any opposed? The motion passes unanimously 5-0. Thank you. Next on our agenda is board and commissions. We have an item to appoint members to our county budget committee. Do we have a staff report today?
We have Jack Liang.
I know we have multiple budget committees and we have information in our packet, but I wanted to make sure to see if there was a staff report you wanted to highlight.
Good morning, Chair Harrington, and good morning, Commissioners. This was actually presented at last week's work session with you, and we have 3 budget committees that we are recruiting this year, and with multiple vacancies on all 3 of them. So we have a list of candidates for you to consider and appoint. So I'd be happy to answer any questions.
Well, so I'll read them off. We have an action today to appoint Leroy Bentley and Karen Bolin to the Washington County Service District for Lighting Number 1 Budget Committee, so that's 2 aspects, with terms ending June 30th of 2022. Another is to appoint Anthony Mills to the Enhanced Sheriff Patrol District and Urban Road Maintenance District Budget Committee for a term ending June 30th of 2021. And to appoint Melissa Laird, Stephen Barron, and Raymond Eck Jr. to the Enhanced Sheriff Patrol Service District and Urban Road Maintenance District Budget Committee for terms ending June 30th of 2022. And lastly, to appoint Bruce Young to the North Bethany Community Service District Review.
North Bethany County Service District for roads.
Thank you. Budget Committee for term ending June 30th of 2022.
As read by our chair, that is the department's requested action, and I move that we approve the requested action.
Second?
We have a motion and a second. All those in favor, please vote by saying aye.
Aye.
Any opposed? The motion carries unanimously, 5-0. Next, we'll move on
Thanks,
to
Jack. Good job.
We'll move on to public hearings for support services to adopt the resolution in order to amend the revised personnel rules and regulations and adopt temporary policies T-311 and T-312. Eva Labonte is here for a staff report.
Yes, thank you, Chair and Commissioners. Good morning. We are here, as you just said, to adopt a resolution in order that will change the personnel rules. This goes back to how we are managing going forward with the coronavirus pandemic. So I'll take each one separately so we can go through each piece. The first one is a temporary policy 311, which provides for more time off for employees dealing with coronavirus issues and also dealing with the issues of managing their kids and having childcare issues. So this is a United States Congress enacted this law effective April 1st. So this policy is reflecting those laws. They are specifically from the Families First Coronavirus Response Act, or FCRA, and also amended by the Coronavirus Aid, Relief, and Economic Security Act, or CARES Act. So what these policies do, the first one has 2 separate sections. One is Emergency Paid Sick Leave, or EPSL. And what this does is provide employees up to 80 hours of time off where they can care for their own physical illness, the illness of other people in their family they need to take care of, or taking care of their children who are home unexpectedly because schools are closed. The other part of it is the Emergency FEMLA, Family Medical Leave Act, and also Emergency OFLO, adopted by Oregon Family Leave Act. This offers time off for parents who have children who, again, are not able to attend school and they need to care for them specifically. So this is a policy that will help the parents and help people who are sick take care of themselves during this pandemic. Are there any questions on that? Commissioners? Nope. Okay. The second policy is policy T312. And this is in response to our amazing employees who continue to work through this coronavirus pandemic, and they are coming to work and need to be here to provide service to the community. So what we have done, or what we're proposing, is to raise the vacation cap from 360 hours to 480 hours. This will allow employees to continue to accrue vacation that they can't use right now because they are busy working and responding to this emergency. This will expire on June 30th, 2021. And at that point, they need to go back to the 360-hour cap that we currently have in place for our personnel rules. The second half of it is we have our exempt employees are eligible for what's called MAPS, or extra administrative leave time, for the work that they put in outside of their normal 40 hours. They earn an additional 40 hours every fiscal year. So this will extend the ability to carry that time over into the next fiscal year. Typically, it expires June 30th if you don't use it. And again, a lot of these employees are working and can't take vacation or can't take this administrative time off. So we're extending that cap to 80 hours, and that again will expire June 30th, 2021, which will allow people to use that time they've earned to get some well-deserved rest. Any questions on that?
Any comments from commissioners on this item?
I'd just like to say that I think it's a very smart idea, obviously. And you said that the cap expires in June of 2021 on the additional vacation time, correct?
Correct.
So do they have to go, will they have to have used the additional hours and drop down to the 360 by June of 2020?
By June of 2021.
2021, correct?
Yes, that's correct. So right now, if you hit 360 as far as your accrual rate, you stop earning more vacation. And so this is to help those people carry that over. And we extended it out to the next fiscal year so people have time to use it.
Okay.
Because as we all know, this could be a situation that goes on for months. So we want to give people an opportunity to take that time off.
Great, thank you very much.
Was the 2021 date, was that a federal guideline, or did we establish that in the state of Oregon?
The policy 312 is a Washington County policy. That part was not enacted by Congress. That's just a policy that we're choosing to do. Many of our neighboring agencies are doing the same thing. So we picked June 30th, 2021 because that's the end of our fiscal year. And again, we wanted to give people the opportunity to use that time they earned. So once things start to get a little bit more back to normal, we didn't want employees to feel rushed to take that time off. We wanted to give them till the end of next fiscal year.
I was suggesting that maybe that was a little bit too short of a timeline because if we extend this period of demand through the next 6 months or something, and here we are in January, and these people now have 120 extra hours of vacation, and we're not really going to give them the opportunity to take that. So that was why I was questioning why we did the June 30, 2021, and thinking that might be a little bit too short. So would we have the opportunity if this thing extends to longer than we anticipate, are we going to have the ability to maybe extend this period of time? Would we just come back to this commission and we would extend the period of time for them to utilize that vacation hours?
That's correct. We would come back and ask to extend that time.
All right.
I share your thoughts on this, Commissioner Willie. I would like to see us make sure that we have revisited this no later than the end of the year. We're not even at phase 2 yet. So it's going to be pretty darn hard for people to take a vacation when you can't basically go anywhere. I mean, even it's like all the bathrooms are closed. So taking a road trip is a little problematic. So I think you've done a great job of putting a marker out there with the end of the next fiscal year. But please, let's revisit this the end of the year and see if we're going to need to make adjustments. Because if things aren't even open then how are we going to try and enable folks to take that additional vacation time between then and the end of June. So we do want to be reasonable. Yeah,
We will do that.
that's great.
I just want to comment, I share those views that just expressed by the chair and by Commissioner Willie. And
I would also like to thank you for the good work on the write-up that accompanies this resolution and order. It was very clear, and as a result, I didn't have any questions.
Thank you.
So now we need to conduct a public hearing. So I'm going to open a public hearing. I need to look over to our board clerk, Kathy Jacoby, to see if we have anyone in our audience out in Zoom land.
There is no one registered. On that note, let me just make a quick announcement that those who wish to provide testimony in this way on any agenda item, they are provided oral communications at designated times. You must register in advance. So you can visit the How to Testify page on our website, and it's just going to the county website, Board of Commissioners, board meetings, and then How to Testify, and it should lead you all the way through. At that time, then I will receive an email that lets me know what you'd like to talk about, and you'll have your opportunity.
So I'm just going to pause here for a moment just to give folks who are participating or may be participating electronically the opportunity to raise their hand.
There's none at this time.
Okay, and our meeting host says there is none, so I'm going to close today's public hearing. And what are the wishes of the commission regarding this resolution and order?
I move that we adopt the resolution order to amend the revised personnel rules and regulations and adopting temporary policies T311 and T312.
Is there a second?
Second.
We have a motion and a second. All those in favor, please vote by saying aye.
Aye.
Any opposed? The motion carries unanimously 5-0. Thank you, Eva.
Thank you.
Next, we'll move on to the action items section of our agenda. We have 2 action items today. The first is to declare an emergency related to COVID-19. And first, we're going to have a staff report. Mr. Rapplier.
Madam Chair, members of the board, yes, this is the 4th extension of the emergency declarations first enacted on March 4th. And again, it extends it for 14 days. There was a modification to the agenda item based on some recent community feedback we received. We received 7 comments for people who are opposed to extending this extension based on the impacts of the closure to the economy. And as I mentioned at the work session, it's the governor who establishes the closure order, and the county does not have the authority to countermand or do anything different than that order. So again, this emergency declaration just directly affects how the county really operates during this emergency. So we're requesting the board extend that emergency declaration to May 5th. And at that point, we propose to have an ordinance that would allow emergency declarations to go up to 30 days. But again, if that's up to 30 days and if the board doesn't want to go all the way to the 30 days, they can do that at that point. So you'll be seeing that on May 5th. Thank you.
Are there any questions or comments from district commissioners?
The only comment I'd make is I appreciate the 7 comments. I certainly understand the frustration. We're all frustrated. The economy needs to get going again, but this is a governor mandate. We're certainly not an island in this state, so we need to support it.
Any other comments from commissioners?
Well, this is tough, but I mean, we can't do business if life itself is at stake. So we got to strike the right balance, and this is more of an internal policy for us that allows us to, expedite personnel and purchasing powers, and we need every power that we can that we're allowed to under our county charter to implement and to speedily bring this to a successful conclusion in this county. So,
any other comments? Seeing none, I'll just add that I appreciate that everyone in the agency is working very hard to see us not only as an agency, but us as an overall Washington County community through this crisis. You're doing tremendous work. This emergency declaration, as noted, sets parameters for how we continue our operations. It also enables us to take advantage of special crisis funding that is made available either at the national level through our federal government or at the state level. So there is some benefit to our following through in this means. So do we have a motion to adopt this resolution and order to declare an emergency related to COVID-19 and to continue the declaration for another 2 weeks?
So moved.
Second.
We have a motion and a second. All those in favor, please vote by saying aye. Aye. Any opposed? The motion passes unanimously, and we have continued our emergency declaration until May 5th of 2020. The next item on our agenda is an item that we moved off of the consent agenda to authorize the Transportation Development Tax Annual Index Adjustment. And I know we have a staff report, so we'll call our Director of Land Use and Transportation up to the table to take us through a staff report on this item, please.
Thank you. I'm actually, Kathy, can we bring in Erin Wardell? She's going to walk us through a brief presentation. Erin's our principal transportation planner. So Erin, if you want to go ahead and walk us through.
Hi. Good morning. This is Erin Wardell, Principal Transportation Planner in the Department of Land Use and Transportation. We do have a PowerPoint to share this morning. And hopefully that's coming up on the screen there. I can't see it yet.
Neither can we.
Yeah.
Okay, good.
One second. Oh, wow, we have many windows of view. That's pretty.
There's a lot of me at that meeting.
Never enough.
I could get a lot of work done.
There we are. Now we have the
There we are.
presentation.
Thank you
Take it
very
away,
much.
Erin.
So today we're talking about our annual rate adjustment of the transportation development tax. Please go to the next slide. I wanted to start by giving a brief overview of the history of the transportation development tax. This is a unique program within the state of Oregon, probably within the country. It's a one-time tax/system development charge. It's assessed on new development and some redevelopment within Washington County. It was approved by county-wide vote in 2008. It applies across the county in both unincorporated and within the cities. At the time the tax was created, it was estimated to cover 28% of system capacity needs associated with new development and growth. Next slide. The transportation development tax rates are based on a development's estimated impact on the transportation system. We use the Institute of Traffic Engineers rate table based on observed traffic generation by different land use types. As I said, it's assessed across all jurisdictions. Most of the cities administer TDT within their jurisdiction through an agreement with the county that they will follow the procedures and administrative rules. Each city collects its own TDT, and unincorporated Washington County collects its own, and then can apply that money towards qualified transportation projects. Next slide. Over the course of the program, we have generated about $23 million a year on average. Over a third of that has come to unincorporated Washington County, and the rest has gone to the cities. So about $14.2 million on average for the cities, all of the cities combined, and $8.7 million for unincorporated. Next slide. The annual rate adjustment was established by the TDT code in acknowledgement that costs are going to go up over time, and we wanted the program to be able to increase so that we can continue to pay for needed improvements. The way that it's written in the ordinance is that the Board of County Commissioners must authorize by May 1st each year, but it's a non-discretionary action, and it takes effect on July 1st of each year. The calculation methodology is based on a 5-year rolling average, and that was intended to take into account natural ebbs and flows of the economic cycle. Next slide. This slide shows some of the history since the full TDT rates were implemented in 2004 of how these rate increases have gone. This year's calculated rate increase is 3.36%. In 2015, where the 5-year rolling average still included recession years, quite a few recession years, the rate was just under 1%, and it's gone up pretty consistently since then to today's 3.36 estimate. Next slide. This table shows what the rate increase will mean for different selected uses. So for example, for a single family detached home, on July 1st, the rate will increase by $300 a unit. For an apartment, $197 a unit. For an elementary school, $15 per student. And then for a general office, $316 for every 1,000 square feet, based on the total square footage. Manufacturing is 108 total square footage of 1,000 square feet. And fast food restaurant was 983, same measure, and supermarket 834. Next slide. LUT staff briefed the Washington County Coordinating Committee and the Coordinating Committee's Technical Advisory Committee. The TAC meeting happened before the Stay Home, Save Lives order, so we were in a little bit of a different state back then. So at the time, there was no concern with the rate increase, and so it was recommended for approval. We have consistently heard from our Technical Advisory Committee as well as through county's capital project staff that the rate increases don't keep up with what they actually see in the field. And so there's never been a concern with the annual rate adjustment before. The Washington County Coordinating Committee met last Monday, which was of course after the Stay Home, Save Lives order. And at the time there was concern about economic uncertainty and if this was a good time to raise any kind of a tax or system development charge. Next slide. After that meeting, LUT staff talked to County Council, and we determined that the rate increase is non-discretionary. It must be approved by the board before May 1st. That's why we're here today. If the board would like to delay the rate increase, though, we have identified 2 different options which you could choose to pursue. The first would be to adopt an ordinance maintaining the current rates indefinitely, and then build in a reconsideration in 6 months. We could also adopt an ordinance delaying the implementation of the rate adjustment to a date certain. The board could choose to direct staff to draft an amendment ordinance for consideration on April 28th, with the intent that that ordinance would be adopted before the July 1st rate adjustment takes effect. Next slide. Some of the implications of delay that we put together is that if we apply this year's 3.36 increase to last year's revenue, it would generate about $614,000 countywide. $145,000 of that would be unincorporated Washington County. Now we can't say for sure that next year's revenue would be the same as last year's, so this is just an estimate. Delaying that rate increase for 6 months would reduce the revenue by about $307,000 because we're looking at half a year. Just to give you an idea of what we could purchase with that amount of money, the cost of a traffic signal at an intersection ranges from about $600,000 to $1.2 million, depending on the size of the intersection and the complexity of the project. Next slide. Some additional implications are that less revenue would exacerbate already divergent revenue and project cost trends. We know projects are getting more expensive and more complicated over time. The 5-year moving average was included in order to avoid either rapid increases or decreases in the rate adjustment. As I've discussed, our capital project staff have consistently reported that the rate adjustments are not keeping pace with their project costs. And at the time TDT was created, we had estimated that it was covering about 28% of the need, but over time we think that that's gone down. And so reducing the amount of funding available shifts the burden to other funding sources or reduces projects that can be built. Next slide. And that is all that we have prepared today. We can now take questions.
Are there any questions of staff at this time?
Yeah, you referred back, Erin, to a 5-year rolling average. We know that that this next year will probably show a decline in certainly the TDT revenues if we leave it at the current pace. But how much impact would that have to be to really modify that 5-year rolling average so that it actually goes considerably lower than 3.36, I guess, the recommended increase? So I was just looking back at the first year, 2008 or 9 or something, was that when?
2015 was the first.
2015, and it was 0.926, and that was the 5-year previous rolling average, I guess is what I was thinking of there, which was obviously years where we're coming out of that severe recession. Hopefully we don't go that direction, but I guess my concern is that are we in an environment for possibly the next 6 months where a 3.36% increase would actually have a negative impact on things? And I don't anticipate that, and I saw on slide 7, so the next slide, yeah, those costs, I guess that doesn't say much to me. That tells me what a 3.36% increase, what additional cost that is, but it doesn't tell me what the total cost per single-family detached home would be under that, or the apartment, or the other categories. So I'm not getting a full picture there, just what the rate increase would impact.
Yeah, and I have the rate table. It's included in your packet under what was consent item 2B. Just real quickly, so for the 2 residential uses that were listed there for the single-family detached, it would bump the rate from currently just under $9,000 to about almost $9,300.
Well, but if I might interrupt, what he was asking about is the components that go into calculating the 5-year average. So if you bring up attachment B, right, that is the 5-year rolling average.
Correct.
Of the 3 major components: the National Highway Construction Cost Index, the U.S. Bureau of Labor Statistics.
There it is, yeah, thank you.
And
I see that now.
The average annual change in real market value. So those are the 3 components. Okay, so we get a new year for each of those, and then take that 5-year rolling average weighted index to come up with the percentage increase. So that is the source of the 3.36 increase.
Thank you, Chair. I had not seen the attachment B. I was looking more on, and the information I was also asking is on is on page 48 of our packet, I think.
And on attachment A.
Yeah, attachment A, thank you. So yeah, thank you, Stephen. I see the information now.
There's a lot of numbers in here, so good questions. Commissioner Scouten, you said earlier you had some comments or questions?
Actually, yeah, thank you. Was there a staff recommendation?
Yes, our staff recommendation at this point would be to go ahead and proceed as Erin described, based on our conversation with County Council. The rate, the index adjustment as it's described in the TDT code, is a non-discretionary action. So we believe that today, whether the board wants to institute some sort of a delay or not, you should go ahead and adopt the rate adjustment today as a non-discretionary action. And then if the board were to choose to implement or institute some sort of a delay, then we would sort of follow up with an ordinance that could be implemented ahead of the rate adjustment taking effect to adjust the rates.
As a follow-up, do you have any recommendations with respect to whether we should delay or not?
Our recommendation would be to go ahead and proceed. I think as Erin pointed out, one of the big concerns that we've had is that over time, because of the effects of the rolling average, the increases have not kept pace with project costs. At this point, we've bid a couple of projects since the institution of the governor's order, and we haven't seen substantial price decreases at this point. What happens in the longer term, we honestly don't know, but we feel that implementing the increase now is helping us to essentially make up some lost ground.
Thank you.
Commissioner Treese?
Thank you, Chair. I'd like to understand more about the discussion at WCCC and the impetus for asking for this delay.
Sure, and I guess I could look to Commissioner Rogers, perhaps.
Sure, I have some very brief comments. One, reasonable people can come to different conclusions. That's always the case, and around this table, people are reasonable. I'm a little bit conflicted and have always been because I helped to develop the criteria for how we got here. And so if this were normal times, I would say the 3 whatever it was, percentage is a very modest increase. I mean, it really wouldn't amount to anything. That was all considered at the WCC. You had 6 mayors from my district, which constitutes over 80% of the population, vote to defer. You had 4 and potentially 5 from District 4, which is well over 80% of that district, all asked to defer. Had 1 from District 1, because there's only 1, and asked to defer. They did so not because they didn't want the revenue. As you can see, 2/3 of the revenue goes to them anyway. They thought the optics, and I followed up with some of them, they thought the optics was wrong at this point to simply delay, and they knew that they were having revenue issues. Was not a major concern in their mind. What was concerned is getting the economy back and getting home building back, and they're hearing lots of questions regarding housing, and this just adds to the housing costs. So there isn't a right and a wrong answer here in my mind. I mean, if we defer it, yeah, it costs a little bit of money, but it could always be adjusted in 6 months. If you don't want to defer it and you want to institute, I took it off the agenda because I am going to be respectful to over 80% of my district mayors asking me to vote to defer, and so that's what I'm doing.
And I might add, during the Great Recession, there were a series of actions recommended by the WCCC and ultimately adopted by the board to slow down if you remember, the original intent of the TDT was to essentially double the rates that we charged for the TIF, which was its predecessor. And that was intended to happen initially over a 4-year phase-in period. So TDT rates would increase 25% per year until they had effectively doubled the TIF rate. And the TDT was adopted just as we were in the Great Recession early on. And so there was the phase-in schedule was extended and rates were discounted both during that period of time. And so that's why in that earlier slide you saw the full rate implementation actually happened in October of 2014. The original schedule was for the full rates to be implemented in July of 2012. So during the recession, there was an extended period where the rates had been discounted and the phase-in, the step increases were delayed. So there's some precedent for having done things like this if the board were inclined to delay. But as noted, our feeling at this time was just that because we feel that we've already lost some ground in terms of purchasing power, if you will, in the TDT, and given the non-discretionary nature of the index adjustment, our staff recommendation was to move ahead.
Any other, Commissioner Willie?
Yeah, back to the permitting. I think I heard in a presentation recently that there have been some jurisdictions that have actually slowed down the permitting process. I think I heard you say that we are not doing that. We're trying to actually accelerate and improve our permitting system to actually stimulate some of that if we possibly can. Are you seeing a significantly decline in permits coming through the system? Not that we're slowing them down, but just coming in the door?
We haven't seen that yet. We just received our March numbers, and they were actually fairly robust. We were surprised, honestly, by how robust things were still. And again, I think the uncertainty is just what April may look like and how things evolve going forward. We just don't know. But yes, we have taken a number of steps to try to ensure that we are open for business. Even though we're not physically open to customers, we continue to provide a number of our services online, by phone. we are doing some limited by appointment contacts with folks as needed to exchange paperwork and that sort of thing. So we're very interested in trying to help keep construction moving. That was one of the things that the governor did not put a moratorium on, so we're trying to help facilitate that.
Yeah, my comment is in terms of optics. I think the optics, what I've heard consistently until very recently, is a lot of people are very concerned about congestion, which means that we need to put in the infrastructure, the traffic lights, put in the traffic circles, make the road improvements. And even during the Great Recession, our population continued to grow. And we had continued development. And I think that the amount is modest in any case. I agree reasonable minds can differ, but I think the optics down the road when this is behind us in a year or two, that we have to say no to some improvements because of what we've done here is not going to play well. And frankly, we put people to work when we build road projects and we make those improvements. That's putting people to work. That's keeping the money circulating. What we don't want to do is put a stop to things. And our concern is recession right now, not inflation.
So I'll go next. I don't have any questions. I want to thank staff for putting together the memo of April 17th that you have provided to the board. I thought it laid this out very well. It is a layout of the history of the transportation development tax that was not readily available to the members of the Washington County Coordinating Committee, some of whom have not been elected in their roles for very long. So I think this provides for an information gap that existed at that time. As noted through the presentation, the increases are looking at costs. As Commissioner Schouten reminded us, we do have tremendous transportation needs. I want to applaud Mayor Keith Mays of Sherwood for reminding his peers that when we put in new development, we do not undersize the pipes. And delaying this means we would be undersizing the pipes. We're already behind the game, and we need to keep forging ahead for the longer term. This rate increase is very modest and I believe very necessary in our community. So I will be voting in support of adopting the rate increase. What are the wishes of the commission with regard to this resolution and order?
I move for the recommended action.
Is there a second? I second it. All those in favor, please vote by saying aye.
Aye. Aye.
Any opposed?
Aye.
The motion carries unanimously 5-0.
Oh, no. 4 to 1.
Oh, sorry, 4-1. Thank you. That takes care of all of our action items today. Erin, thank you for participating electronically. Next, we have our second oral communication. Do we have anyone signed up or raising their hand?
I do not see anyone. We are clear.
Okay, then we'll move on to board announcements. Are there any board announcements other than our usual, which is reminding our community and ourselves of our upcoming meetings? Next Tuesday, April 28th, is the last Tuesday set of meetings for the month. Thereby, we will have our work session in the afternoon and our board meeting in the evening. It will be our second time having our meetings using Zoom, but it will be in the evening, so perhaps more people will have the opportunity to participate. So that's why I want to call attention to the new procedures available on the Washington County website. And then we have meetings slated for Tuesday, May 5th, an extended work session on May 12th, and then a set of meetings on May 19th. Anything else, commissioners? Seeing none, do we have a motion to adjourn?
Move to adjourn?
Second.
We have a motion and a second. All those in favor, please vote by saying aye.
Aye.
Any opposed? The motion passes unanimously, 5-0. Thank you.